Welcome to Speaking in Spoons with your host, Christina Brookman.
Hi, I'm Christina, your host for Speaking in Spoons, a chronically ill podcast. And this is, I think, our first Spoonie Sunday of the year for 2024 and our third season. I've been needing some personal time off and some taking care of me time. But I wanted to start doing these again, not regularly, but as I can, and kind of share with you a process that I'm going through with diagnosis, um, that I think a lot of you out there will understand. And maybe those in the professional world, medical world, hearing my experience from my end might give some tips or tips, but help you better understand maybe where patients are coming from or small little things that are happening in the office completely unintentional, um, that cause severe problems for patients down the line. So, first of all, I hope you have been able to see our episodes so far this season. We've been blessed to have some really wonderful guests. Our April episode, we interviewed the director for the upcoming film documentary Complicated, which deals with the complex issues of pediatric pain, children living with complex and rare disorders. The focus of the film is Ehlers-Danlos, um, and how children and families are having struggling in the medical community, with treatment, with care, with false information being out there, and also how the involvement of CPS. And not only do we get to talk to the director in the first episode, in the second episode, which just aired on the 30th, we brought in consulting producer Donna Sullivan, who has a plethora of experience as an advocate, especially in the world of pediatric pain, and John Rodas, who is the president and CEO of Connective Tissue Coalition and has been an advocate for those in the connective tissue world for over 20 years. So if you haven't, please listen. This isn't just about Ehlers-Danlos. It's about those living with complex, invisible illnesses, often rare disorders, and just kind of the systemic issues that we face in the medical community that I think doctors and nurses would like to change as well. And maybe this film will help us figure out ways to start conversations to come up to some better solutions because it's just not working right now. Um, what I wanted to talk about is I uh, sorry, I'm having a lot of word finding issues recently. Well, not recently, over the past year, which I discovered is an issue that goes along with my migraines, and also with the EDS, like the brain fog. But the specific word finding issues is part of my migraine disorder, which I found interesting. So um, like I can see the word, I can see the object, I can see the person, but I just cannot get it out of my mouth. And I've also begun stuttering and things like that. Um, but we have been working to figure out what is going on with my liver for the past 2 years. I noticed some elevated enzymes in my livers that it kind of like ebbs and flows. Um, and they did a sonogram of my liver, which at that time showed fatty liver and stage 1 to stage 2 fibrosis. But the doctor was thinking it might be something autoimmune because of all of my autoimmune flags and inflammation markers. So referral to hepatology, and also my gallbladder was just filled with gallstones, but I wasn't symptomatic. So she said, let's hold off on surgery till you're symptomatic. I finally got to see the hepatologist, and he was great. Um, and then we set up for liver biopsy, and lo and behold, like 3 days before the biopsy, I had just a horrible, horrible pain. Like it felt like an alien, like the movie Alien, when like what I would imagine it would feel like if that alien was bursting out of my gut and just stabbing. And I thought it was my migraine. Because I was nauseous too, I was vomiting, all of that stuff. And then when the hospital itself went ahead and did a liver biopsy, since they were in there to remove my gallbladder because it was inflamed. And they came back with fatty liver and stage 2 fibrosis. And then he looked at the slides because we had them sent to him. And it gave me more comfort having him look, since he's specialized. And he said, you don't have any problems with your liver. You do have stage 1 fibrosis, but that's caused by this rare disorder called primary sclerosing condylitis. And there is no treatment for this. People usually end up needing a liver transplant. As I started reading, I had to stop reading, but I started going through a grieving process and sharing with people. He said, next we'll do an MRI. There is a clinical trial, if you would qualify. So I was like, so is the MRI to say whether or not I like to confirm if I actually have it? He said, oh no, you have it. This is just to show which duct it's affecting, like the small duct or the main duct. And he kind of drew me, a picture to explain what was going on, and it was very helpful. Um, but then the MRI, in order to participate in the MRI, the whole thing you're having to do breathing. So like you have to breathe in for a certain amount of counting and then hold your breath for like really long amounts of time. I have obstructive and restrictive lung disease, and I have trachea malacia, which means when I go to inhale, my trachea shuts. So I've got a lot of pulmonology or issues going on. And had I known that before the test was about to happen, I would have consulted my doctor to see if there was something that could be done. Because, usually when I was having problems with like my paralysis or like the convulsions that can happen with my migraines, they would just put me out for the migraine. But you can't do this for this because it's all based on breathing. Um, so it has to be done at some point. We're just trying to figure out, like, consult with pulmonology and my doctor about kind of the best way to do that. Because the reading basically said they couldn't really tell. It didn't look like there was some problems. It looked like fatty liver, but it also said that there seemed to be something with the left um, tube. Um, but it was just really hard to tell just because there was so much movement. It was difficult to read. Um, so then the nurse practitioner today was saying, well, you don't have PSC, which normally I would be like, great, because that's a horrible thing to have. But at the same time, I was just like, I just spent like a whole week kind of starting the grieving process and allowing myself to go into acceptance and work through things, and um, to get a diagnosis and then unget a diagnosis and be back in a, liminal in between space is just, it's an emotional roller coaster. Um, and what was weird to me is everything that the original hepatologist and I had talked back, I went back and looked at notes. It wasn't in there. It just said, anyways, my point is, when I did look at today's notes from the nurse practitioner, who was wonderful, she was very nice to me, but obviously, like it hadn't been read yet by the hepatologist. So, like whenever I've had scans before, the specialist always reads them. They don't just take the radiologist word. I mean, it's a huge input, but they are a specialist for a reason, and they go in there and they want to see. Um, and that, so this was the first time it hadn't been reviewed before my appointment. And they had also not consulted, but more than that, I was looking over, God, I'm like, I need words. Looking over like system review, um, and like cardiology, a GI negative for constipation and diarrhea. Like, not to be gross, guys, or TMA, but I live with constipation and diarrhea. That's why I'm about to see GI. One of the many reasons I'm about to see GI. But that was also why I was in their own ER the other weekend, just bleeding, after an hour's worth of diarrhea, and they were concerned it might be post-op issues. But I'm getting rushed in for GI. So to have that marked there, that's a problem because that continues on in my history. Um, Negative for easy bruising and clots, not true. I have Ehlers-Danlos, and I had bruises all over me today. Muscle skeletal, it did say muscle pain and weakness. Neurologic headaches, negative for dizziness, not true. Memory problems, not related to HE. But uh, psychology, negative for anxiety and depression. No, I do have anxiety, and I have PTSD. I mean, we could go on and on, but it talked about like the abdomen, soft, not, I never got an abdomen exam, and yet it's talking about an abdomen exam. Cardiovascular, no murmurs, no, like nobody listened to my heart at all. It was just heart rate and blood pressure. And this is huge because heart history is really big in my family. Um, and respiratory, lungs clear. So it's just neurologic. This is what really bothered me. Alert and oriented, true. Cranial nerves grossly intact. No, I can't pronounce the word. I'm not a doctor. I am just throwing it out there. I'm not a doctor, and I'm also having trouble, especially since the surgery. But because it's a lot, it's been a lot. But my point is, there was no neurological exam, because had there been any form of neurological exam and she asked me to do anything with my hands or my feet, I would have gone into some sort of drooping paralysis, hemifacial spasms on the left. So this is why it is so important. Like, doctors have no time, and that is a system that is set up that is pretty much out of their control. So I don't know how we fix this, but I do want to advocate on their behalf. But because they're having to dictate stuff, and then I'm guessing nurses are also filling in stuff, and they're rushing because it's overstaffed and all of that stuff, things that people wouldn't think are important, get misinformation is in there. In fact, my whole list of doctors are like, it's like 3 years old, and most of them I don't even have anymore. Like, so that's really bad, especially when I bring in my own cheat sheet, which has everything updated. I bring it in every time. But I've learned that even though these poor nurses spend like 15 minutes updating my medications and making sure everything's correct, um, it has to be changed by a doctor. So if a doctor never like changes it or approves that change, all of that gets lost and we're back to where we were. So I don't know what the solution is. But like I've mentioned before, I lost caretaker services because of notes like this that were like completely inaccurate, and notes that if my doctor saw, he would be horrified because he gave me a prescription for a wheelchair, but the note said that I had a normal gait. So I would just advise doctors and nurses don't copy and paste. And um, I don't know what else to do, but we need to, as much as we as patients are frustrated and angry at the system, I think we also need to look at the doctor's perspective of the crazy amount of work and load that is coming to them. And how does that get fixed so that we as patients get better care? So that when I'm about to go into surgery and my anesthesiologist is going over my med list, it's not entirely incorrect. That happened to me 4 weeks ago, and that was terrifying. And my gut said, don't do the surgery. And I wish I'd listened to my gut because I don't think I'd be, well, I know I wouldn't have been under medicated for my pain. And I also would have had the liver biopsy done correctly from the beginning. Maybe not the MRI. That's a little unique with my paralysis. But, sometimes listen to your gut and just know you're going to have to watch your notes because they're dealing with a gazillion patients. It doesn't excuse it, but I'm just saying because it does affect you. It affects insurance approvals. If you're on disability, it affects you keeping your disability and getting resources. So just make sure you double check your notes and what's in your charts, because if that is not what it's supposed to be, you need to file for a correction. And it looks like I got a whole lot of homework to do, which I don't have the energy to do right now. So I just wanted to share all of this with you. That now I'm re-going through the process. She was kind enough to put in there not fatty liver, but they are working on changing the name of it to metabolic, I believe, liver disorder, like because there can be other causes like people that have metabolic processing disorders, which my doctors think like enzyme processing, fat processing, all of that, which I do. I've had my whole life. I just never, I never went to I didn't start going to the doctor as an adult really until I had to when my back went out, um, right after my wedding. That's when I started realizing I should start seeing doctors. And then I just want to share this experience with you because I'm hoping it what I'm experiencing, what I'm learning through this journey might help some of you out there. And hey, maybe some of you have some ideas. If you do, write them in. I'd love to share them with guests. We're a community, and I think the better we can get at not isolating each other by all of our different disorders, we have chronic illness, we have disability, and there's so much overlap with all of that that we have shared universal experiences, and together we are stronger. So that is my message. And I'm just hoping everybody is doing okay out there. or at least finding a way to find your happy place. I've mentioned a couple times, but just in case you haven't heard, there's the Calm app on your phone, but it is also on HBO, and you can listen to the voices of Idris Elba, one of my Hollywood husbands, or Nicole Kidman, or Lucy Liu, and other people tell you the serene stories of like water, and it'll show you images of water, or like how um glass is made, and it'll show eruptions of volcanoes and sand and all these things. But I mean, when you're having a migraine day, I just put a pillowcase over my eyes, because I live in an Alaskan dark room, cold and dark is my happy place. Um, but those might be things worth checking out for you. And I'm thinking of everybody out there. And as always, we love to hear your ideas, your feedback, what's working, what's not working, what you want to see or hear. If you want to share your story or know someone who does. Again, like as I said, we're a community. So save your spoons and take care of yourself. That's the biggest thing. Just make sure to pace yourself and take care of yourself, which is the hardest thing to do. Till next time. Bye.
If you want to contact us, please send a DM or email to speakinginspoons@gmail.com with any stories you have or would like to interview with us on any of our upcoming topics. And check out our website for all of our upcoming episodes and what's happening in the Speaking in Spoons community at www.speakinginspoons.com. Thank you for listening to Speaking in Spoons, and have a great day.